Let's take an in-focus look at the humble and subjective practice of what we can call blocking, which is a method that can be used to provide an isometric stimulus to recover an injury site, namely in the area of the shoulder, whether that's in extension, flexion, internal, external rotation. First of all, it's used as a diagnosis tool to be able to get familiar with where your either acute or chronic or overuse injury is most felt. And the perspective is that we want to bring ourselves towards this range of motion and provide an isometric stimulus which is going to contribute toward its recovery. So there's two main things that we have to consider. That the isometric stimulus isn't too much, so I have to grade it in terms of the sensation and the feedback that I get. So obviously some slight discomfort is going to be expected, but never any sharp and shooting pains. We want to stay away from these areas. And likewise, the range of motion that we go into, we don't want to be forcing into ranges of motion which are not prepared yet for those stimulus, which, for example, are still experiencing some inflammation, whether that's due to impingement or just because of the state of the tendon or the muscle. So in this way, it's a hugely subjective practice, which means you have to follow the sensations, follow and self-diagnose what particular ranges of motion, what positions, and the intensity which is going to be optimal for stimulating your recovery. So we're going to use just some basic tools. Some things that are hugely valuable here to block are, for example, a wall. Also like a doorway and even a bar can be useful, and also our humble stick. So choose your stick. You can have sticks of different sizes and different widths or different girths. So let's just consider a few different scenarios. So one scenario is, for example, injury or overuse of the rotator cuff. So this basically means you'll start to feel it in places where you are, for example, pulling into end ranges of external rotation or even internal rotation. And of course, we have different positions, different planes of motion. So for example, there's been cases in the past where I've experienced an injury to one of the internal rotators of the shoulder. And so even just pressing on my belly and using this as a block in and of itself, pulling towards me, I felt some discomfort, and if I pressed too much, there was pain. However, this is the area that needs a stimulus in order to recover, so this was one of the blocking mechanisms I could personally use. I could just press internally rotating the hand against the stomach, keep the shoulder well set in the joint here, and just using this as an isometric stimulus. But of course, if it's more of an issue in external rotation, then for example, the block I can use can simply be a hand placing here, and maybe in just this angle first of all, this particular range is enough, but then over time you want to develop through the whole range. But then of course it becomes a bit impractical to hold here, so then I might use a wall and press against a wall. This is just one particular range of motion, but of course we can be working also in the sagittal plane here. Maybe there's an issue, for example, with the internal rotation or the external rotation in this position. So for example, I could use the hand as a block here, but again, it kind of skews my structure a little bit. I can much more productively, for example, use like a wall here, just pressing against the wall, or any other fixed object in my environment. If I'm in a gym, as an example, I might set like an Olympic bar at an optimal height and just externally rotate against this. Or again, if it's internal rotation in this position, I could place my hand on top of something and just pull down slightly with the hand to provide an isometric stimulus there. So that's, for example, considering in the transverse plane of internal external rotation, the sagittal plane here. But then of course it may even be like in the frontal plane. I might, for example, just experience some tenderness or pain if I'm working in external rotation in this position. So I might block with the hand here and just lightly externally rotate. Over time, for example, if I want to build up more range, I would bring myself kind of deeper into the range, but perhaps in the initial instance, this is not available. So the idea of recovering these particular injuries is that I'm gradually increasing the range of motion available to me by creating a stimulus throughout that range of motion. So as I said, if for example the issue was just pressing towards my stomach here, I felt pain in the internal rotators, I would just choose a place where I'm not experiencing that pain, but just some slight discomfort. I would work here, but then over time, I would want to ensure that the full range of this internal and external rotation is available with producing a contraction without any pain. So I'm gradually over time increasing the range of motion. Another common one can be, for example, positions of overhead flexion or extension of the straight arm. The perspective is exactly the same. So let's say if, again, I've suffered, maybe it's an acute injury or an overuse injury of the shoulder. A very common one when it's related to the rotator cuff is that I have trouble lifting it to 90 degrees. But then when I bring the arm above 90 degrees and overhead, it actually feels completely fine. This can be due to acute injury or inflammation in the rotator cuff and or even to do with the tendons of the more superficial deltoids and shoulder muscles. However, when we're overhead, this is essentially what can be called the hammock position. This is when we hang out very relaxed, because the rotator cuff is essentially no longer under tension. It gets to relax in this particular position. So it often seems strange that here is very difficult, but then when I bring it overhead, it's absolutely fine. So of course, we want to recover this particular range up towards 90 degrees, and of course, just going above into shoulder flexion. And we would use exactly the same perspective. So let's say if it's quite a severe injury, as I've had in the past, and I can't lift my shoulder any further than this without any pain. Well, then the blocking begins just here. I can just block with the other hand, and I'm going to provide an isometric stimulus. I contract, and then I relax. Ensure the shoulder is nicely set in the socket, contract, and then I'll relax. And again, of course, over time, as it gets higher, it becomes a bit more inconvenient to block. So for example, I might block against a wall, just with the hand against the wall, and contract against the wall, and then relax. And let's say, for example, now the issue is perhaps more specifically an overhead flexion. Again, it can be quite tricky to kind of block here. So I might use the doorway or use a bar. So I can use the bar here as an example. I can now just place them at this kind of 45-degree elevated angle. I just keep the fingers nice and straight, and I pull them, contract, and relax. And then over time, I might even use the doorway, contract, and relax. And then finally, for that last range of overhead, then I might, for example, use a wall behind me, and then I might just contract against the wall, and then relax, contract, and relax. And likewise here, you might find exploring that perhaps it's a specific angle. Maybe if you're slightly further out, this angle feels okay, but then when I slightly abduct the arm outwards, that here there's still some slight discomfort, some pain, some inflammation that needs attending to. Of course, this works exactly the same way if you have sensations and problems with straight arm pulling. I would pull, for example, down in this position, down towards the arm here, further down, and then at some point I might even just be pulling against the leg here, contracting, relaxing, contracting, relaxing. Now, if it's more kind of a superficial deltoid, the tendons or even the muscles of the shoulder in different positions, the stick can be very, very, very useful here. So one technique we can use is just pulling outwards against the stick. And again, you might explore hand positions, maybe close, maybe hip width, maybe a little bit wider here as well. So let's say, for an example, I've stressed out the lateral shoulder. It might be connected to rotator cuff, but what I essentially feel is that when I abduct in this position, that I experience some discomfort or even pain. So for here, I can quite simply contract, pulling outwards against the stick, and then relax, and work contract, relax here, or I can work it here. Or again, it might be this also combined with a slightly flexed angle of the shoulder from here. And likewise, it could be an extension from here. I can contract, relax, relax. I can also, as an example, if it's just shoulder extension, perhaps with shoulder extension just being slightly extended here and then pulling outwards against the stick, even if it's more anterior here, I might find that this produces a nice stimulus too. This is also super useful for the rotator cuff for a blockage, for blocking. So I can, for example, in the ranges of external rotation, I can place it on the outside of the arm and I can block with the hand on the inside, and I can press inside and then relax. And of course, this allows me to enter further ranges of external rotation. It can also be done, for example, here unilaterally in the transverse position, or it might just be enough if I place the two hands on the back of the stick and then I just press inwards. Notice that the elbows are not kind of pulled in, so it's not such an extreme range of external rotation. It's just extended and slightly external. And here I can block, I can press, and then relax. But over time, of course, I want to have that range that I can completely keep the elbows in contact, and then I can contract here and relax. So that would be the further end range of this position. Again, here I can explore, for example, overhead, maybe pulling outwards with the stick and pulling out against the stick here, and perhaps there's different ranges of motion which stimulate the affected area. So always staying with this idea that we're trying to find an optimal position, a range, so the range and the position in which I can provide a healing isometric stimulus, a nice and controlled stimulus. Ultimately to the extent that there is range of motion being developed and the pain is reducing. Now, with regards to variables, we want to have just a few simple positions that we can use. So ideally just 2 to 3 positions. Find 2 to 3 positions that are attending to these particular issues that you have. So let's say, as an example, when I reach my arm into shoulder extension and external rotation, I feel a little pain. This can be very common for a rotator cuff injury. Essentially, this feeling when I go to put on a bag, let's say if I have a bag on my back, I'll put on the jacket, this motion here going inside and extending, I experience a lot of pain. And again, this can be due to just shoulder impingement syndromes and things like this. But I might find that one of the most productive ones for me is perhaps just blocking with the hand behind the back. So I might just do contract, relax for this position. So this position of internal rotation, but I'm actively externally rotating and I'm pressing, relaxing. That might be one position. Then the other position might be me working with the range of external rotation. The second one I would use, and I would work this one. And I would develop the range of external rotation here. And then the last one I might use is blocking from a position of shoulder extension. So perhaps I would find maybe I could even use the wall here, or if I had an elevated surface like a cabinet, I can press downwards on the cabinet and pull towards me. Another simple way that you can use this is to take a belt, a judo belt, or even the straps of a gymnastics ring, place it around a post or anything, or a standing bar, and then just pulling isometrically against the post. Now, because you are trying to produce a consistent isometric contraction and you want to control the intensity very kind of subjectively, it's better not to work with elastic bands in this context, because an elastic band, it's difficult to get like a consistent intensity of the stretch, because the band is always kind of stretching a little bit. It kind of changes. Maybe the band's a little bit looser, a little bit tighter. When you're pulling, you're kind of producing not truly an isometric force. It's kind of overcoming a little bit. Bands can be useful for more tensile movements, so moving through ranges of motion with strength and eccentrics and things like this, or concentrics, but that would be a little bit later in the rehabilitation process. In the initial process, we just want something stiff, something fixed, something that blocks, so like a strap or a stick or a wall or a bar or something like this. Last thing that's really important to mention when you're exploring these different positions I've mentioned it a few times, but that the shoulder, the scapula, is, you know, set in its socket essentially, and in the position that you're in. So what does this mean? It basically means that, let's say, for example, again, I'm pushing with the shoulder behind the back. I want to ensure that I'm in a structurally sound position. So if my shoulder is lifting up and I'm pushing here, this is not a structurally sound position for the shoulder. It could actually potentially cause more harm than good. I want to just ensure that it's kind of, the shoulder is kind of set down, pull back in its socket, it feels locked in, and I work in this position. So I might find, for example, that if I kind of compensate a little bit and just let it loose, that I can lift my hand here, no problem, there's no pain. But if I really set the shoulder, I might find that, wow, actually I can hardly internally rotate it and extend it in this position. And then maybe perhaps I could just only work here. And perhaps this is the true pain-free range. Whereas here, of course, I have a lot more range, but it's not coming from the actual rotator cuff, right? It's coming because I've displaced the scapula, I've let it lift, it's not set in position. And the same goes, for example, if I'm extending in this position here. If I start kind of elevating with the shoulder here and pulling, the stimulus is not happening so much on the deeper layers, the more profound layers of the, for example, the small rotator cuff muscles, as if I just keep it nice and set in the socket here, quite strict, and just pressing from this position. Overhead is very common as well. And if I'm using the bar or the wall and I'm pressing here, notice the difference. If I'm just pulling up with the shoulder, it becomes a lot more about just the superficial muscles of the shoulder here, and not so much activation of the smaller rotator cuff muscles. So I would set the scapula and I would just pull backwards, as if almost the scapula is being pulled down like a drawbridge and pulling the arm up. And you may find it's just really just not much contraction which is required to provide that stimulus. Ultimately, in these ranges in the end, you find the ranges of motion which are the most problematic for you, and then you want to again ensure that over time the full range of motion is available with, you know, a maximal contraction. So for example, as I mentioned before, I had issues in this particular position, but now I would want to be able to pull as hard as possible with a nice set scapula into my stomach without any pain. And even, for example, let's say it was abduction in the transverse plane here, I would in the end want to be able to be in the end range and pull the arm back as hard as possible, almost for like a count of 5, and there's no pain related to that injury. And that would tell me that that the injury site has been fully recovered in these types of isometric contexts. Of course, after that, we want to explore going through the ranges of motion, transitioning through and plugging it back into loaded contexts too. Coming a step back and thinking about variables and time under tension. We can give a quite standardized prescription. So we've already said choose about 2 to 3 exercises. And in each of these exercises, you want to accumulate a minimum of 30 seconds time under tension, up to around a maximum of 60 seconds time under tension. Now, we can scale this quite easily and say that in the initial instances, when there's, you know, strong inflammation, it's better to use less repetitions and longer isometric contractions and just adjust the intensity. So perhaps you would just do like 3 10-second isometrics, or even just 2 15-second isometrics, reducing the intensity slightly and just producing a nice consistent contraction here. So I'll just hold for 15 seconds and then relax. In this case, you then might also do up to a minute, say 4 times 15-second contractions. As it continues to develop over time, you start to increase the repetitions and reduce the amount of time under tension. So I then might, after some time, do 6 times 5 seconds. Or if I'm at the higher end of the volume, I might do 6 times 10 seconds. Ultimately, after time, let's say if I'm in the final stages and this range of motion has been recovered, I might just work, for example, with 5, let's say 10 3-second isometrics. I might just squeeze really hard. 1, 2, 1. Relax, press. 1, 2, 2. Relax, set, press. 1, 2, 3. And again, for example, if I finally found myself working against the wall, extending, 2, 1, relax, press again, 1, 2, 2. One final thing, because if it's an acute injury or if it's even just a chronic overuse injury that's developed over time, is, it's very often unilateral, which means it's one side. So do I just work the one side? I would say yes, the predominant work should be focused on the one side, the isometric stimulus. However, at the same time, explore bilateral contacts and also have interest in what is available on the other shoulder, because if you have, for example, an overuse injury in the shoulder, and it may be the case, it's likely to be the case, it's to do or related beyond the execution of the actual exercise and things like this. Perhaps something structural. Let's say you're quite internally rotated and you have restriction in external rotation, which is generally going to be related to both sides of the body. So you can use this rehab as an opportunity to explore and develop that other side as well. So let's say, for example, I just have the injury here. As I mentioned, I can work isometrically here, kind of unilateral, but I would say favor the bilateral variation and also get the other side stretched out too. I can, for example, let's say press for one arm against the wall here, but perhaps I can also work with two arms pressing against the wall backwards there. When I'm working overhead, maybe one arm is the one that's affected, but maybe I can use two arms. At the same time, there is the case that when we're working focus on that particular arm, especially when it's in the early stages, that it has a lot of intention there. So I want to be focusing again on making sure it's kind of stable. If it's been a bad traumatic injury, it might be the case that it's really kind of feels like it's floating around like in the socket, in which case I will have to concentrate and go, okay, it's set, and it's really micro motions that are ensuring that it stays remained in the stable position while I'm producing the isometric stimulus. In this case, then yes, I would probably just want to really focus on that one side. But as it kind of develops, let's say, this position overhead and externally rotated, I might just start in the end working with both arms here. I'm just working with this contract, relax position, working further into shoulder extension here, okay? So just a brief recap, we've been using the practice of blocking to provide an isometric stimulus for helping to recover specifically issues from the shoulder, whether that's impingement or overuse injury. And we propose that it needs to be a subjective and self-directed practice because injury site, location, etc. is going to be very, very specific to you. So it's first of all going to be an exploration, but of two main things. The range that's available, or the range at which you're sensing, a pain and things like this, and also the position. Is it in more kind of an overhead position? Is it more of a shoulder extended position, a shoulder flex position? Is it external rotation, internal rotation? Is it in the sagittal plane here? Is it in the transverse plane? So position and range are the main things that you need to discover. Then for practical application, we said with that information, you take 2 to 3 different exercises and ideally provide an isometric stimulus for them every single day, if not multiple times per day. It can be as part of your morning practice separately as a priority practice, but then also within your main sessions of practice as well later in the day. Even just one set going through this, accumulating up to 60 seconds time under tension, a minimum of 30 seconds, is going to be valuable. You could, for example, also do like 2 to 3 rounds of a lesser amount, 15 to 30 seconds, and do 2 to 3 rounds of these exercises that you choose. But ultimately, we want to see that this stimulus is helping to develop the pain-free range of motion over time. And it's something that you will just have to keep attending to, using those same movements to explore how things have changed with your injury whilst providing a healing stimulus on the road to recovery.